They laugh at dinner. They reply to your texts. They show up to work. And every single night, they feel completely, utterly empty inside. This video might be about someone you love. It might be about you. Stay with me. Section 1. The scale of the invisible crisis. Before we talk about what depression is, let's talk about what it actually looks like in the world. Globally, an estimated 5.7% of adults suffer from depression. That is over 280 million people, more than the entire population of Brazil, waking up every single day carrying a weight that most people around them cannot see. Women are 2 times more likely than men to experience depression. 1 in 3 women will develop depression in their lifetime. Adolescents between ages 10 and 19 globally have a 5.7% prevalence of depression, making it one of the leading causes of illness and disability in young people worldwide. And here is the number that should make all of us pause. Only 1 in 3 people with depression globally receive any treatment. That means 2 out of every 3 people suffering right now are doing it completely alone. Untreated, undiagnosed, often unaware that what they are feeling has a name and a solution. Ask yourself right now, do you know someone who has seemed off lately? Someone who went quiet, who pulled away? Keep that person in mind as we go through this. Section 2. What depression actually is. Here is what most people get wrong about depression, and why that misunderstanding costs lives. Depression is not just sadness. Sadness is a human emotion that comes and goes in response to life events. Depression is a medical condition, a clinically recognized disorder involving measurable changes in brain chemistry, neural circuitry, hormonal regulation, and inflammatory biology. When someone is depressed, 3 critical neurotransmitter systems are disrupted: serotonin, which regulates mood, sleep, and appetite; dopamine, which drives motivation, pleasure, and reward; norepinephrine, which governs energy, concentration, and stress response. When these systems go offline together, the result is not simply feeling down. It is a fundamentally altered experience of reality, one where the future looks permanently dark, energy feels physically impossible to generate, and pleasure is chemically inaccessible. Recent research has also identified chronic systemic inflammation as a contributing factor in a significant subset of depression cases, meaning that for some people, depression is as much a biological inflammatory condition as it is a neurochemical one. This is why you cannot simply tell someone with depression to cheer up or think positive. You would not tell someone with a broken leg to just walk it off. Depression is a medical condition. It deserves medical respect. Section 3. The symptoms. What it actually feels like. The clinical criteria for major depressive disorder includes symptoms lasting more than 2 weeks, but the lived experience is far more nuanced than a checklist. Let me describe what depression often actually feels like from the inside, because recognition is the first step toward help. The exhaustion that sleep does not fix. You sleep 9 hours and wake up more tired than when you went to bed. Not because you didn't rest, but because the mental load of simply existing is consuming more energy than your body can restore overnight. The numbness that replaces emotion. Many people expect depression to feel like overwhelming sadness. For many, it feels like nothing at all. Activities that used to bring joy, music, food, people you love, feel completely flat. Empty, like watching your own life through glass. The invisible anchor. Simple tasks, replying to a message, making a phone call, showering, can feel physically impossible. Not because of laziness. Because the neurological system that generates motivation and action has gone offline. The convincing lie your brain tells you. Depression has one defining cognitive feature above all others: it makes its own permanence feel like an objective truth. This is just how I am. It will never change. There is no point. This is the most dangerous symptom, because it is entirely false, and the brain generating it cannot see that. Curiosity question. Have you, or someone you know, ever described any of these experiences? The answer for most people is yes, and that is why we are having this conversation. Section 4. Real story. What it looks like from the outside. Consider this story, composite of real experiences shared by people living with depression. Marcus was 32. A project manager, liked by everyone, always showed up, always delivered. But at 7 p.m., when the laptop closed, he would sit on the edge of his bed for 45 minutes, unable to move. Not sad, exactly, just absent, like someone had turned the volume all the way down on his life. He didn't tell anyone for 2 years. Because he thought, I have a good job. I have people who love me. I have no right to feel this way. That thought, I have no right to feel this way, is one of the most common sentences spoken by people with depression. And it is one of the cruelest lies the condition tells. Depression does not check your credentials before it arrives. It does not care how much you earn, how loved you are, or how much you have to be grateful for. If you are feeling what Marcus felt, keep watching, because the second half of this video is for you. Section 5. Causes. Why does it happen? Depression does not have a single cause. It is a convergence, and understanding this is critical for removing blame. Biological factors. Genetic predisposition. A first-degree relative with depression increases your risk by 2 to 3 times. Hormonal shifts, postpartum depression, thyroid dysfunction, and cortisol dysregulation all directly alter mood neurobiology. Chronic physical illness, pain, inflammation, and cardiovascular disease are all independently correlated with depressive episodes. Psychological factors. Childhood trauma, abuse, and adverse early experiences increases depression risk by 30 to 40% in adulthood. Childhood trauma such as physical abuse increases depression risk by 3 times in adulthood. Cognitive patterns, specifically, a habitual tendency to catastrophize, personalize failures, and interpret ambiguous situations negatively, both contribute to and are amplified by depressive episodes. Social factors. Isolation, financial stress, relationship breakdown, grief, and lack of social support are all documented triggers. Urban living increases depression risk by 20% compared to rural areas. And critically, stigma, the social pressure to appear fine, to stay strong, to not burden others, is itself a factor that delays treatment and deepens suffering. No one chooses depression. It is the intersection of biology, history, and circumstance, not a character defect. Section 6. Myths versus facts. Let's dismantle the myths, because they are actively preventing people from getting help. Myth 1. Depression is just weakness. Fact. Depression involves measurable changes in brain structure and neurochemistry. Depression is a medical condition caused by complex biological, psychological, and environmental factors. Treating depression with medication is no different from using insulin for diabetes or blood pressure medication for hypertension. Myth 2. If you have a good life, you can't be depressed. Fact. Depression does not correlate with external circumstances. It is a disorder of the brain's regulatory systems, not a response proportional to your objective situation. Some of the most high-achieving, publicly celebrated people in history have suffered from severe depression. Myth 3. Antidepressants change your personality and are addictive. Fact. These medications restore normal brain chemistry balance without altering core personality traits. While healthcare providers should supervise discontinuation, these medications are not addictive substances. Myth 4. You should be able to snap out of it. Fact. Telling someone with depression to snap out of it is the clinical equivalent of telling someone with a fractured spine to stand up straighter. The biological machinery that generates willpower and positive thinking is precisely what depression disrupts. Myth 5. Talking about depression makes it worse. Fact. Research consistently shows the opposite. Open conversation about depression reduces stigma, increases help-seeking behavior, and can be literally life-saving for the person you are talking to. Do you know someone who still believes these myths? Share this video with them. This might be the most important thing you share all year. Section 7. Treatment options. What actually works? Here is the most important thing you will hear in this entire video. With proper treatment, up to 80% of people with depression achieve significant symptom improvement. Nearly 21 million American adults experienced major depressive disorder in the past year, yet research shows that with proper treatment, up to 80% can achieve significant symptom improvement. Depression is one of the most treatable conditions in medicine. The tragedy is not that it cannot be treated. The tragedy is that most people never access treatment. Here is what the evidence supports. Therapy. Cognitive behavioral therapy, CBT, helps identify and modify negative thought patterns that contribute to depressive symptoms. This structured approach teaches practical skills for managing difficult emotions and challenging distorted thinking patterns that maintain depression. Research shows that psychotherapy alone can be as effective as medication for mild to moderate depression. Many patients prefer therapy because it provides lasting skills and insights without medication side effects. Medication. Antidepressant medications work by modifying neurotransmitter activity in the brain, particularly serotonin, norepinephrine, and dopamine systems. Selective serotonin reuptake inhibitors, SSRIs, like sertraline and escitalopram are typically first-line choices due to their favorable side effect profiles and established safety records. Medication is not for everyone, but for moderate to severe depression, it can be the difference between surviving and recovering. Lifestyle medicine. Exercise has the most robust evidence base of any non-pharmacological intervention for depression. Meta-analyses consistently show that regular aerobic exercise, 30 minutes, 3 to 5 times per week, produces antidepressant effects comparable to medication in mild to moderate cases, through direct upregulation of BDNF, brain-derived neurotrophic factor, and dopaminergic activity. Sleep, social connection, sunlight exposure, and reduced alcohol consumption are all independently documented modulators of depressive symptom severity. Emerging treatments, transcranial magnetic stimulation, ketamine infusion therapy, and digital CBT platforms are expanding treatment access, particularly for treatment-resistant depression where first-line options have not been effective. The evidence is clear: treatment works. The only step that has a 0% success rate is not trying. Section 8. How to support someone with depression. If someone you love is struggling with depression, here is what the evidence, and the lived experience of millions of people, says actually helps. Do this. Show up without an agenda. You do not need to fix anything. You cannot fix anything. What you can do is be physically, consistently present. Research shows that social support alone, the felt sense of not being alone, measurably reduces both the severity and duration of depressive episodes. Ask the direct question. Research consistently shows that asking someone directly, "Are you having thoughts of suicide?" does not plant the idea. It signals safety. It opens a door that the person may have been waiting for someone to open. Do not be afraid of the question. Be afraid of not asking it. Listen without minimizing. The most harmful responses to depression are comparative minimization. Others have it worse. At least you have X. These shut conversations down and deepen shame. The most helpful response is the simplest. I hear you. I'm here. You don't have to be okay right now. Help with the practical. Depression makes routine tasks feel impossible. Offer specific help, not, let me know if you need anything, which places the burden back on them, but, I'm coming over Saturday to sit with you, or, I ordered dinner for you tonight. Specificity is love made practical. Encourage professional help, gently and persistently. You are not their therapist. You should not be, but you can be the person who drives them to the first appointment, sits in the waiting room, and texts them afterward. That bridge between suffering and help is where lives are saved. If you are watching this and something in this video felt uncomfortably familiar, I want to say this to you directly. What you are feeling is real. It is not weakness. It is not permanent. And it is not the truth about your future, even though it feels like it is. The brain that is telling you things will always be this way is the same brain that is sick right now. And sick brains lie about prognosis. People recover from depression every single day. People who felt exactly what you are feeling right now. People who could not imagine ever feeling different, and who do. The only thing standing between where you are and where they are is one conversation. One appointment. One phone call. If you are in crisis right now, please reach out to a crisis line in your country. In the US, call or text 988, the Suicide and Crisis Lifeline. In the UK, call 116123, Samaritans. Help is real, available, and closer than it feels. And if this video helped you understand something about yourself or someone you love, please share it. Because somewhere in your contact list, there is a person who needed to hear exactly this and didn't know how to ask for it. You might be the reason they do. If this video gave you something, a name for what you've been feeling, clarity on how to help someone you love, or just the knowledge that you're not alone. Like this video so more people can find it. Subscribe, because we cover mental health, neuroscience, and human biology every week at this depth, without the noise. Drop a comment. Tell me, what was the one thing in this video that hit closest to home? Your comment might be exactly what someone else scrolling needs to read. Share this with one person. Just one. You do not need to say anything. Just send it. Let the video do the talking. Take care of yourselves and each other. See you in the next one.